with Mayor DeMargo and Judge Samaniego, as well as your legislative delegation here, Representatives Blanco, Moody, Ortega, Fierro, and I think, is it fair to say soon-to-be Representative Perez? Is that a done deal, or is it? Congratulations. And we just concluded a very long meeting where we had the opportunity to do several things. One is to learn about the status of the spread of COVID-19 across the El Paso area, as well as to learn more about what the needs were and what the vision is going forward. And there are several things to make sure that we put in context where we stand as we gather today. One thing to note is to note and applaud progress when you see it. I think everybody understands that El Paso faced some meaningful challenges with regard to COVID just weeks and months ago. I think people should understand that the way people across El Paso collectively responded to that outbreak of COVID, to the increased hospitalizations because of COVID. That response led to what is now a decline in the number of people testing positive, a decline in hospitalizations, what will be a decline in fatalities. There's going to be lives saved because of the way El Pasoans responded to COVID. However, maybe the most important thing I could tell you today is that even though the numbers are going down as we speak, COVID has not left El Paso. The COVID virus has not left Texas. It hasn't left the globe. COVID exists in El Paso just as much as it existed last month and 2 or 3 months ago. The only thing that has changed is that El Pasoans have been much more vigilant with regard to the way they act. Everybody is wearing face masks. In just the last couple of days, I've talked to doctors in every region of the state. And the doctors in every region of the state have said the very same thing, and that is the primary reason why cases of COVID are going down in Texas is because people are adopting the practice of wearing a mask when they go out, staying at home if at all possible, maintaining safe distance from others, and sanitizing your hands. It's very simple to engage either in business activity or education activity if people follow the very best safe practices. However, if people let their guard down, if people stop using these safe practices, you will see an increase in COVID-19 again. I send you that alarm here early in August, knowing that several things are on the horizon that could worsen the problem. As you know, we have back-to-school days, and whether it's going to be in-classroom learning or online learning, there still is this notion that when things are back-to-school times, people may let down their guard. If they let down their guard like they did across the state of Texas during the Memorial Day holiday, it will lead to an increase in the spread. One thing about returning to school is if it's in classroom, the strategies for opening up schools create very safe environments. It's less safe about the gatherings that may take place after school. It could be right after school and kids hanging out. It could be in the evening, or it could be on the weekend. It could be after events when families gather together in homes or in backyards, whatever the case may be. We've seen time and again already gatherings like that across the entire state of Texas have led to the transmission of COVID-19. In addition to back to school, we have 2 other events coming in just the next few weeks. One is Labor Day. Now, as I mentioned just moments ago, one of the reasons why we saw a spike in the number of COVID cases across the entire state was because of the way that so many people went out and celebrated Memorial Day. And they engaged in activities that led to increased transmission of COVID-19. I think because Texans saw what happened, in the aftermath of Memorial Day, during the 4th of July, they were far more responsible, and there was less transmission during the 4th of July holiday than there was during Memorial Day. We need to remind Texans once again about the dangers of gathering together over Labor Day and spending time together, whether it be for backyard barbecues or even with large family gatherings or larger parties or going out to events at different locations. If you do things like that without following the safe practices, it will lead to greater transmission of COVID-19. And I'll mention one last thing that we need to all recognize, and it's fair to admit, and that is people have what we call COVID fatigue. They're tired of wearing a face mask. They're tired of leading more constricted lives. They're tired of not being able to gather together with friends, and we get that. But the COVID disease doesn't care about COVID fatigue. The COVID disease is just looking for another body to attach itself to. And so if you get COVID fatigue and you let your guard down, COVID is going to spread very rapidly, like it did in June, that led to the hospitalization rates that we saw in July. Now, with that context, I do want to talk about some of the things that we just discussed with leaders from your community. One that I mentioned moments ago, and that is in our meeting here in El Paso, just like in our meeting that I had earlier today in Lubbock, just like in meetings I had in Dallas, I heard the same thing, and that is high compliance with wearing masks led to a decrease in the spread of COVID-19. Also, it led to a sense of people taking care of each other and everyone sending the same message about warnings about COVID-19. But let me double back on that concept about taking care of each other, because it's something that's very profound in El Paso. People in El Paso, they love and care about their family members, their friends and neighbors. And it's that sense of love for others in this community, in part that you saw the way the community galvanized in the aftermath of the horrific shooting that took place this month last year. But it's that same sense of community where people galvanize around a cause to prevent death in this community caused by COVID-19. And because you care about each other, that causes you to wear a mask and protect the elderly and things like that. Another thing is that one of the strategies that I maybe have seen more effective in El Paso than any other place in the state of Texas was the strategy that Chief DeAgostine talked about in dealing with homeless shelters. A very effective strategy dealing with a very vulnerable population. And where is he? Chief? Where, my eyes behind me. Chief, good job in the strategy that you use and that your entire team used in addressing the homeless very effectively. One thing that we talked about was heightened concern about the Hispanic community, especially those with underlying conditions like diabetes, and what can easily happen when you do have family gatherings and the way that it can lead to the transmission of COVID-19. I was educated today about some of the programs adopted by some of your leaders, such as the Cluster Management Task Force, where they do reach out and target the elderly, an organization called CHAMPS, where they work on assisted living facilities, and the guidance that El Paso leaders provided to El Paso businesses about safe ways to open up your business that will reduce the spread of COVID-19, as well as the mitigation teams that they have that go out around the community to make sure they're doing all they can to mitigate or to slow the spread of COVID-19. So these are outstanding standards that are part of the reason why COVID-19 has slowed in the El Paso area. Now that said, we also talked about ongoing needs. And there will be ongoing needs until we have the immunizations available that will put an end to COVID-19. One of those ongoing needs is additional testing sites. And working with Chief NIMKID as well as our team in Austin, Texas, we will work with El Paso leaders to achieve several goals. One is to ensure the availability of ongoing testing sites. Two will be to look at the possibility of increasing or adding testing sites. And then three would be adding more tests. Now that said, I do want to emphasize a point that we discussed here, but also has been discussed elsewhere in the state. And that is, there are more testing sites and more test collection equipment available all day, every day, than there are people getting tested right now. So let me phrase this differently. There are lines open. There are tests available for people as we're speaking right now that people are not going up to getting tested. So we strongly encourage people across the entire county to take advantage of an opportunity to learn about a testing location near you where you can go get tested and ensure that you're going to be able, if nothing else, to let your family know that you do or do not have COVID, let your coworkers know, or let your employer know. Whatever the case may be, just know there are tests available for you as we speak, and we strongly encourage everyone to go get tested for COVID-19. We also talked about ongoing and maybe future needs at hospitals, including certain unique nursing capacities and requirements that may be needed if COVID begins to expand, but also hospital needs that could arise because of the confluence of having both COVID and flu occurring at the very same time here in the coming months. And then I think that's about it of what we covered. We covered the waterfront in there. The bottom line is this, however, and that is around me in this room are a bunch of El Paso leaders that have really stepped forward with a lot of innovative ideas and really with tireless energy and responded to the COVID-19 pandemic in a very profound and effective way that has led to a downturn in the spread of COVID-19 in El Paso County. With their ongoing diligence, but mostly with your ongoing vigilance, we will be able to continue to master COVID-19 in El Paso County going forward. With that, I'd like to turn things over to your mayor, DeMargo.
Well, thank you, Governor. As you heard, we had a very in-depth discussion covering basically everything that you could cover, I think, related to COVID-19 and this pandemic. I want to thank the Governor again for his visit, for his support. Our ongoing conversations related to COVID-19 go back to the 1st of May when we had some spikes and some concerns, and I called him and he had sent out his surge team. And then Judge Samaniego and I both were concerned about the opening of our economy to the level we were opening at that time, and we talked the governor into delaying a week our opening, which I think long-term has helped us. We are approaching the flu season. It is imperative that people get the flu vaccine as well as testing for COVID-19. All the hospitals prepare for surges during the flu season, and we need to have, people need to do the vaccinations for flu. It is critical. It goes hand in hand with COVID-19 and the prevention. So we want to continue to encourage the testing. Several of us have been on the airwaves lately talking about the fact that the glitches that had occurred a few weeks ago are gone. We're back up to date on the testing. The delays for the return of your test is down to no more than 3, maybe 4 days maximum, and in certain cases less than that. We've accelerated our testing capacity through the Department of Public Health here with UTEP. UTEP's going to be able to do an extra 2,500 test analysis per week. They're doing a great job for us, so we're integrated with that. The judge and I have some concerns still about the travel between here and Juarez by U.S. citizens. I in particular, and I think the judge agrees with me, that we want to continue to restrict transportation, people coming back and forth to the essential only, not the non-essential. We're still in this pandemic, and it's affecting both sides. But basically, the bottom line is we are most encouraged and appreciative of the governor's visit here and the support he's providing, and Chief DeAugustino and Dr. Ocaranza and Chief Rodriguez and all of our support explained to him what we thought we had in the way of successes as well as what we would have in the way of needs coming forth, and that was well covered, I think, and we appreciate very much your support here.
Thank you. Judge Samaniego.
Thank you. Well, I too like to thank the governor for, as you know, I've pushed pretty hard that we have a unique situation. Our logistics here in El Paso and Doña Ana are pretty unique, and we were allowed, and I thank him for being able to be here and hear from us directly. We have an incredible collaboration. We talked about the fact that it's a community that has come together. I think the numbers are a lot less than would happen if we didn't have the excellent collaboration between Public Health, Office of Emergency Management, the relationship that the mayor and I have had throughout in trying to address some of these challenges that we have. So we're very thankful for this collaboration that we have. We understand, and I thank the governor for being candid about, what we still need to do. Our community has done great, and we recognize it, but we're not out of the woods, and we have a lot of challenges, and we've talked about some things that are coming up very quick on us on the flu season. But I know we're a community. We're going through a very difficult time. August 3rd just passed by, and so I thank the community, thank the governor, Chief Kidd, and everyone else that this is the way we're going to do this is for all of us to pull together, for everybody to pull in the same direction, and I know that we'll be able to accomplish this. We've also learned a lot. We've uncovered that we have a very vulnerable community. We have one of the highest indices of diabetes, and so one of the things that I will be requesting from the governor is not only support for COVID, but support for the things that we've identified. What better solution for our community than to address our health issues? So if the flu season comes around and you're healthier, your chances are much better of the severity or of a fatality. And so we've uncovered some things. We have a great task force that is looking at a lot of different things that we need to do. So once again, Governor, thank you so much for being here. That's what we wanted. We wanted all be in the same table and to be able to address these situations in a common way. So thank you very much.
Thank you, Judge. Chief Nim Kidd, Texas Division of Emergency Management.
Thank you, Governor. For the folks that are out there, our job will be continue to support your excellent leaders here with personal protective equipment, with testing materials and supplies, and then with staffing where needed. This building alone is the great symbol of partnership amongst your city and county officials. Having your regional advisory council here, your hospital coordination in one location. That doesn't happen in many places across the state, and I think this is probably the best place that I've ever seen doing that. And then finally, Governor, you mentioned the innovation just going on here with the programs that they put together. We really want to take those, capture those, and start using them in other places across the state.
Very good. Thank you, Chief. And then lastly, before we take questions, I do want to express the gratitude all of us feel for all of the nurses, the doctors, the first responders, the people on the front lines who are putting their lives on the line to save the lives of others. We wouldn't be in the situation we're in El Paso or the state of Texas right now without all of those tremendous healthcare workers, and we appreciate them more than you know. Yes.
Thank you so much for all the positive information that you were able to relay. However, today on the city of El Paso reported 20 deaths, and today is also the 23rd consecutive day that we report deaths in the city of El Paso. Will there be any changes, any scaling back of anything? For instance, Dr. Balanza mentioned that one of the hotspots, one of the reasons that we have so many cases is because of stores, shopping. Will there be any scaling back of anything?
One thing that we did have the chance to visit about in the meeting before coming out here was trying to identify what could be hot spots or transmission zones and making sure that we can address those. And one thing that I talked about is that for every different type of business that is open, there are protocols that must be followed. And to the extent those protocols are not being followed, they can be enforced, leading to the potential closure of whatever type of business that is open that's not following the protocols. Whether it be a store, remember this, stores of any type have capacity limits that must be complied with, and they do not follow those capacity limitations, they can be closed. Second, I will offer this up, and that is, I've heard stories, not per se in El Paso, but across the state, about some restaurants that were exceeding authorized capacity in ways that could lead to the transmission of COVID-19. Those restaurants that are not following those protocols, they too can be closed. And so the list could go on. Bottom line is this, and that is there are so many standards in place that were put in place by doctors knowing that they would lead to a containment of the spread of COVID-19. We need enforcement of those standards, and when we get that level of compliance, we will be able to continue to contain COVID-19 in El Paso as well as elsewhere. Yes?
With respect to schools, you mentioned the safeguards that are in place, which I think a lot of folks are happy about. That said, the positivity rate in the state is above 20%. You said 10% is a red flag. With that positivity rate as current as it is, do you still feel comfortable sending kids and staff and teachers back to schools with the situation the way it is? Well, we know a lot of people are doing it online, but some kids are going to be
Sure. So what I feel comfortable with is giving that decision-making authority to the people who know best about when to open up their schools and how to open up their schools, and that is the superintendents who are put in place by an elected school board. So remember this, and that is every school in Texas has the ability to decide when to open. Is it going to be July, which some did, August, September, or later? Then second, when they do open, how are they going to open? Is it going to be remote-only education? Is it going to be in-classroom education? Or is it going to be a blend of the two? And for how long? Will it be a blend or online only for 4 weeks or longer than that? And then on top of that, there's built-in flexibility for those local leaders if there is a case or more than one case of COVID in a school that will allow the school to shut down, sanitize, and stabilize before opening back up, as well as the flexibility of having local public health authorities say that a particular school needs to close down because of lack of containment-based issues. So there's a lot of different ways that the local superintendent of a school has tools available. And remember this, there may be a level of spread, let's say in El Paso this particular time. I mentioned I just came here from Lubbock, and the superintendent for Lubbock ISD was there, and they are fully prepared to open up for in-class education for students this coming Monday. I'm aware of some other schools in some more rural settings in the state of Texas where the outbreak of COVID is not as substantial, where it is completely safe for the schools to be able to open up. And I'm aware of locations in the state where the spread of COVID is much higher, where they're opening up online, and that's the safest strategy for them. Because of the size of Texas, because some areas have different population density levels, it's important to have flexibility for each school district in its own unique setting.
Governor Abbott, thank you so much for being here. So City Council is going to be deciding whether they're going to be releasing the business names that have COVID-19 clusters. It's a very heated debate at times just because there is, people have different opinions. What is your opinion? Do you believe that those business names should be released that have COVID-19 clusters?
I'm going to leave city council business to city council. If Dee wants to say something about that, he's.
I would just say that I'm not sure that the way you phrased the question is correct. City council has been advised that state law says it's confidential. Most of our spread is community spread. It's not related to a business or an entity. And that whatever the state says we can do, we will do.
But other counties in Texas are releasing that information.
No, they're not. No, they're not. Please verify. They're not.
Governor, did you want to weigh in on the Texas or the U.S. border situation? The president has floated the idea of actually restricting and banning U.S. citizens if they're suspected of having COVID from coming back to land and sea ports. I mean, that could affect thousands of your constituents if that's put into play. Are you okay with that suggestion by the president?
The only standard I am aware of articulated by the president is the agreement that he's reached with the president of Mexico that puts the current limitation on cross-border travel that Mayor Margot was talking about earlier. As I have understood that standard, it has led to a decrease in the potential spread from both sides of the border. And so to the extent that it's working, I think it should continue.
Well, with respect to restricting actual U.S. citizens, like not allowing them back into this country, which is something the White House has said could be done, are you okay with that?
Yeah, I haven't heard anything about that, so I can't comment on it.
Two more questions.
Governor Abbott, hi, thank you for being here. So while funding has been allocated to purchase devices for schools such as Chromebooks, what guidance does the state offer to districts while they wait for these devices to come in, as some states might take more than 2 months?
So, two things about it. One is Texas, the state of Texas and Texas Education Agency are working with local school districts to provide a full array of technology to bridge the digital divide. That includes things like hotspots and laptops, as well as other equipment, to make sure that students who do need to learn online or remotely will have the tools available to do so. I have heard some stories, input, about supply chain-based issues that would limit the immediate access to those devices. And we have a supply chain team working in the state response that will be assisting the Texas Education Agency in trying to accelerate access to those supplies.
Last question.
Will we see legal enforcement for the use of face masks? Currently, a lot of persons are using a fake card saying they can't use it because of medical issues. Do you think it can have like any consequence?
So if, let me make sure I understand your question correctly, and that is, your question concerns enforcement about face masks, but for those who have medical reasons not to wear them?
Yes, but they're using like a fake ID saying that information.
Well, if people are using a fake ID for some purpose, there could be legal consequences for doing that. What we want to do is to establish a standard of everyone who is capable, meaning of their are of an adequate age and don't have medical complications, to wear a face mask whenever they go into public and are not capable of maintaining a safe distance from others. What that has done is, as doctors have made clear, that has reduced the spread of COVID and has saved lives. And hence, we do expect that standard to be maintained, understanding that there may be some small percentage of the population who have certain medical conditions that make it inappropriate for them to wear face masks. That said, for anybody incapable of wearing a face mask, it's important for their health and for the health of others that they do maintain safe distances from others.
Thanks, guys. We gotta go. Those of you who don't know, we're gonna go to the memorial.
Good to see you guys. Thank you all for everything.